Welcome, my name is Caroline Mogure. We start off with our big story. With the rollout of the Social Health Insurance Fund Shif around the corner, a large number of Kenyans are still not well versed on the facts regarding the new era of the healthcare in Kenya. From October 1st, you will no longer have access to the National Health Insurance Fund (NHIF), which will transition to the Social Health Authority (SHA). Kenyan citizens, including dependents, will by law be required to register as members of SHA. And as Kenyans continue to register for the SHA, the NHIF continues to be in effect, with today being the last day of registration. SHA benefits will begin on October 1st. As far as contributions are concerned, payments made before October 9 will be credited to NHIF, while those received from the November 9th will go to Shif. A section of Kenyans are still not versed with the new era of healthcare.
Ni NHIF watu hajakuwa wakilazimishwa kuingia kwa vitu kama hizo, na hii ya kushift hii inalazimishwa.
Log into the website, you get a different dependent that is not your dependent. We don't understand how these dependents comes or maybe are found on your system.
Walinitumia message sasa nikaambia kutoka tarehe mwezi hii ingine hakuna kwenda na Shif huko hospitali. Nataka kuuliza kwa sababu ninaenda kliniki kila wakati, pesa hiyo nitatoa wapi ya hiyo ya Shif na hizo zingine zinabaki na huko.
Huwa inalipa bili zote za kutoka kliniki ya kwanza mpaka ya mwisho na magonjwa yote. Sasa hebu angalia, Shif nayo inakulipia kwa mara mbili. Sasa tunaangalia utofauti wa msaada wa Shif na NHIF hatuoni.
And the difference between the new healthcare model and NHIF are like night and day, with the government adopting the new model in a bid to ease the burden of healthcare on Kenyans. SHA funds will be split into three categories. The primary healthcare fund, whose primary source of contributions will be through government funding. The social health insurance fund, Shif, which will be facilitated by household contributions. And the emergency chronic and critical illness fund, ECCIF, which will also run through government. Universal health coverage (UHC) remains a priority for the national government, with President William Ruto committed to achieving this goal for all Kenyans in line with this vision.
For us to deliver on universal health, first we need a legal framework that will support it. And that is why we went to Parliament. We worked on a legal framework that now gives us, we have now 4 pieces of legislation that will underpin this universal health coverage, speaking to the areas that were problematic in the earlier attempts at universal health coverage. So we have tried using the legislation we have to address the areas that resulted in us not achieving the intention of universal health coverage, as we have all been looking forward to as a nation. The very positive thing about this matter of universal health is that it is a shared issue. It is shared across the political formations. If you look at the manifesto of Kenya Kwanza, universal health coverage is part of it. If you look at the manifesto of Azimio, universal health coverage is part of it. So this is an area where we can all work together without the constraints of political formations. I think, again, we've tried as much as possible to harmonize our views and our plans from between the national government and the county government. And I must commend the leadership of the Council of Governors for, forging the meeting of minds and trying to converge our thoughts.
And after a court ruling on September 20th, the Social Health Insurance Act, Primary Healthcare Act, and Digital Health Act all remained in operation, meaning employers would have to comply with the requirements to register for the Social Health Authority (SHA) and make contribution to the Shif. Salaried employees will make a contribution of 2.75% of the gross salary, with a minimum contribution of 300 shillings per month and no maximum limit. This contribution needs to be made by the 9th of the subsequent month. Non-salaried people will contribute 2.75% of the household income, with a minimum contribution of 300 Kenyan shillings. Just some of the SHA packages include the optical care. Each family will receive a limit of 1,000 Kenyan shillings per year, regardless of the contribution, while dental coverage will offer a maximum of 2,000 Kenyan shillings, though this will only be available once there is a budgetary allocation. For normal delivery, the new model will pay 10,000 shillings, while those getting Caeserian will be paid for 30,000. For individuals needing to monitor their blood sugar and HbA1c test will be financed at 1,000, but only once a year. For kidney patients who need to monitor their creatinine levels, the SHA package will cover 300 shillings. Also once a year, cholesterol monitoring for patients at risk of cardiovascular diseases will be financed at 300 Kenyan shillings, but only once annually. And remember to register. You can dial *147# on your phone. You'll be prompted to provide information such as your citizenship, national ID, number ID, and phone number. You can also visit registration portal at www.sha.go.ke. Follow the instructions to complete the process. That's the big story.